So we're here at the Vancouver conference, the IAS conference here in Vancouver, and we're here with Dazon Dixon with Sister Love. And you're going to bring a perspective of advocacy to this meeting, and you have, and you will, and you do, and you increasingly improve on that. I don't know if that's possible, but you do a great job. And you were on the panel this morning where you talked a lot about prevention, all about prevention, PrEP and treatment as prevention.
Right.
And apart from that, I mean, what do you see this conference doing for, especially for women, because we're going to be talking about the one in Durban shortly.
Sure, absolutely. Well, first of all, thanks, Fred, for having me and for being here. It's always a pleasure.
It wouldn't be a conference if I couldn't get you
to
do something with it.
You're beyond sweet, but no. What I think, first and foremost, I think one of the things that I haven't heard it articulated in this way exactly, but I think that we are finally at the moment where we can do away with the dichotomy of prevention and treatment. And I think that's a critical thing to recognize, is that with the advancement of the science, with the advent of the START study or the HPTN 052, or what we also know as treatment as prevention, with all of the different PrEP studies and the ongoing demonstration projects.
Treatment is prevention.
Treatment is prevention, and that you can use treatment for prevention for regardless whether it's HIV positive people or people who are at risk for HIV and are still negative. So I think that, you know, even as in a lot of different communities, and I think I talked about this, just touched on it a little bit, is that we've been wrapping ourselves around this care continuum of looking at viral suppression and then looking at undetection, that we're also recognizing the real important role of testing everybody and then getting them into the track of care that they need.
Right. And that's the important thing you say, getting them into care, access to care, because I think you were sensitive in the panel this morning, in the press panel, in that this is a choice for them. Now, an informed choice.
Right.
So then it behooves you and me and everyone else out there who's talking about HIV to really talk about the reality and the science, and let them understand the science really is so clear that we can convince them, hopefully, to make that choice.
The science is clear, the implementation is less clear.
Right.
And as a matter of fact, there even might be roadblocks. And so what is our strategy for really using that science to change the minds of governments, to change the minds even of communities who may have been resistant to the notion of the role that biomedical has to play in social and behavioral, and we understand that adherence is behavior, so it's all connected, whether it's adherence to condom use, whether it's adherence to getting tested regularly, or whether it's adherence to taking a pill every day. It's all a part of the same in understanding how important this is to actually get us to the end of the epidemic. So we also have to be clear that we're still working on making sure that individuals have what they need and want and have the access to it, that it's affordable for them, that it makes sense in their social and cultural context, but that we're also looking at it from a community perspective, and that how are we making sure that entire communities that are most impacted are getting what they need and are also able to engage and being able to say what it is that they need and want.
And I think in the trials this morning, they talked about how they could separate them out by site.
Yes.
Because I think, and it doesn't mean that everyone in that site is going to agree the same way.
That's right.
It's not a group thing.
That's right.
But it is to some extent, but it's obviously everyone has to make an individual choice. And that individual choice will affect not only their own health, but the health of the community.
That's right.
So the more people, I think I didn't mention this, and I was going to try to mention it with one of the other scientists, but there is the sense of herd immunity. At some point, you know, whether you don't get everyone or not, it isn't important to get every single person, but get a profound number of people on treatment that will bring that you know,
That's right.
the new incidence of HIV down.
It doesn't hurt to aim for 100. And if we hit 90, that's a really, really good thing. But it really doesn't hurt us to aim for the 100.
And that's why we went with a 90, 90, 90.
That's exactly why.
And then I think it's 90, 90, 90, 90, as Myron said, because there's this prevention aspect.
There's the prevention aspect.
And actually, in that case, it's 96. And really maybe more than that, so we've got high numbers.
Exactly.
We've got good grades.
But you know what I'm really interested in and making sure is that when we leave here, that we're not only clear about what the science is telling us, but that we're clear that when we talk with people, that they're clear about what it means in their lives.
Right.
And
That they
especially
understand the
that
truth.
they understand the truth, and they understand the truth from where they sit or where they live. And then I know that there's still some concern, that we still have some issues and we still have questions about what this means for women. What does this mean for women outside of the realm of reproduction and pregnancy? What does this mean, for example, with ADAPT 067, is that it's actually good news that they're, as opposed to what we've learned from some of the previous PrEP studies around women's engagement, that at least where treatment is available for, whether it's for PrEP or for treatment for HIV, that when people believe in the medicine, when people believe in the science, and they believe who's bringing it to them, and you make it easy for them to get it, they use it. I mean, that's like a no-brainer, but I'm glad we have the science that brought the brain to it, right?
Yeah,
So that's a
exactly.
good thing. The other part, though, is we're going to leave this meeting without having focused a whole lot on at the individual level of key populations. And I think as we leave Vancouver and go to Durban, that, and I mentioned this earlier, is that the same way Durban 2000, 15 years ago now, was a watershed moment. It was a watershed moment because we knew we had the science that millions of people could not access. And that was around treatment. That was what some people call the treatment revolution. Well, we've got a year to think about what it means to now know the science for prevention and look at what it actually means in terms of people actually being able to have it and use it. So I'm looking forward to
You've got
Durban.
a lot of work to do.
Yes, but I'm
Yes.
looking forward to Durban being the prevention revolution.
Yeah.
I'm looking forward to being able to talk about women and girls and young black men who have sex with men, and talk about people who use drugs and how all of these things matter in all of their lives, and that we have to do the work to make it work.
Do you find that maybe the stigma and also the government's criminalization is one of the biggest stumbling blocks? It seems to me that's one of them. I think that'll be brought up more at the next conference.
I think it starts with indifference first. I think there's a lot of indifference. I think there's a lot of, oh, you have this figured out now, you've got the good science, now just get people on pills, without the investment, without the policy that goes along with it, without decriminalizing people's sex and sexuality and identity, and all of that has to be a part of it, but also making sure that communities are educated and informed. And so we can't be in a situation where only those of us who are in this field and in this work every day know all of this good stuff, but that the people on the ground who need it the most to actually help us make this happen know nothing. And that's where we are right now.
Yeah, and I mean even in our country, even
Absolutely.
in the United States. I mean, I
Absolutely.
shouldn't say even, but because
Yeah.
it seems a sort of sense of expectation. But our country is some of the central parts of the country are not aware
We have no
of things.
excuse.
Yeah.
I mean, there are other places where
embarrassing.
it's embarrassing and it's frustrating. It's frustrating in the sense that right now, especially among governments that have opened, that have approved PrEP, for example, as a federal strategy for people who are adults, men and women, that we have actually approved PrEP, but we haven't done the diligence to roll it out in the communities where it needs to be. That's unacceptable. So I'll give you an example, we do so much work with women, and we do these focus groups or we do these community education activities. When we tell women about this PrEP thing, the first thing is they're angry. They're angry like, why didn't I know
Right,
this?
yeah.
Why
And
didn't
they have a
somebody
right to
tell
be
us?
angry.
Why
Yeah.
are they keeping this information from us? I can't imagine that any government wants to be seen by their voters, by their people, that you are withholding life-saving information and resources to actually end this epidemic. I don't
like-
think that's how you want to be
It's malpractice
seen.
if you're talking about your doctor not giving it to you, but what do you call it when your government is not allowing you or pushing it as an option, as a real strong option?
Wholesale
to help-
violation of my human rights. That's what
Exactly,
that is.
exactly.
That's what that is.
Well, now the work that you're going to be doing between now and next conference in Durban is going to be, you've got a lot of work to do. But
Yeah.
but that pre-conference that you're talking about, that is something that that strikes me as very, very important, because you're going to be having a lot of dialogue, and women always have a lot more issues that they have to face in their lives.
Right.
And I don't discount that. It's really critical. but I wanted to make sure that you
Yeah.
got that information out to us.
Yeah, and we're being very intentional about recognizing some of those issues that are not traditionally brought into the HIV spaces and the people as well, right? So, for example, the Women Now Summit that's happening in Durban just before the International AIDS Conference next summer is intended to bring women's health activists, advocates, researchers, some policymakers, donors together to talk about HIV, but at the intersection of sexual and reproductive health and rights. And we say sexual and reproductive because there are so many folks who need access to prevention for positives as well as for people who are at risk, regardless of their intention to bear and rear children or not. And so I think this is also an important moment for us to cross that bridge or that divide that has existed between the sexual and reproductive health community and the HIV women's community for the last couple of decades. So I think it's an even bigger opportunity to bring another dimension of this conversation into the International AIDS Conference. So that is a lot of work, and I'm extremely excited about it.
But we think in terms of making AIDS an exceptional disease, which it
Yeah.
is, but we also want to normalize it.
Exactly.
So the more we can bring people together and realize that we aren't so different after all.
That's right.
And we all are trying to live a life, and live a life healthy.
That's right.
And that's all we're trying to do.
I think there's a role for HIV exceptionalism, but we can tamp it down a bit.
Right, exactly.
Because there's a role to deal with trauma and violence, but it doesn't have to be exceptionalized. And there's a role for sexual and reproductive health, but it doesn't have to be the only thing we talk about in that midst. And so I think the more that we can recognize the unique power in addressing all of those issues that impact HIV and vice versa, or by the convex, then that's what the exceptionalism has to exist in the spaces it needs to, but the integration has to be where we do our work.
Absolutely. And you are a champion of that, and I really appreciate you doing that. And I look forward to the conference. We want to work together with you in that.
I certainly hope so.
Yeah,
I'm excited about that too.
We'll be there early for you.
Yay!
And with you.
Yay! Well, we'll see you in Durban in July.
Thank you so much,
Thank
Dazon.
you. Thanks, Fred. Thank you.